welcome back to my channel. Today I will introduce some of the information about denture and also introduce you about bone reservation and socket reservation and how it can help the jaw to reduce the possibility of bone loss after extraction. And these are the casts that I just want to show you. And probably you don't see the difference, but at a dentist we see the difference. Okay, so this is the cast show that after the extraction of all the teeth on the upper part, the patient have in this case patient have quite a good amount of bone on this side compared to this side. Now all based on the condition of the teeth before the patient the teeth being removed and how was the surgical procedure of the teeth removed. If the surgical procedure went well, dentist didn't do a lot of cutting the bone would turn out quite nice and reserved. And if the condition of the teeth was bad, the dentist had to remove some bone to remove the tooth, and the bone can be diminished more on this side. So that's one example of the upper complete denture case. And the denture is like this, okay? That's how patient wear the denture, okay? Now, the other case that I just want to show you. On this case, this is the lower teeth. The patient bone was now it's become very narrow because they probably during the procedure there was the difficulty of tooth removing. The dentist took out the tooth and probably also have to remove some bone in order to take out a tooth. And if there was no bone graft material or bone reservation, then the bone will be very skinny, right, like that right here. Same thing on this side of this patient case. Also depend also if the patient have removed for those teeth for a number of years, more than 20 years, the bone will shrink, and if you don't have an implant or bone graft preserved there. Okay, so that's one example of the how after the tooth removed, the bone can be really shrinking if you don't do implant or bone reservation. Here's another example. Here's the upper tooth patient were in her 40. She have this tooth removed and no bone graft. You can see there is a volume of bone being missing. Same thing on this area right here. This back tooth here, the tooth were removed, but they look like either the bone reservation or could be how the dentist taking out the tooth. The bone on this area is still really good there. Here's another example of another case where this patient also missing lower anterior teeth. There's no bone graft. There wasn't any bone graft material, or the patient had this tooth removed too early during her age, and over the years the bone can shrinking. And so take a look at the difference between the bone volume here and here and here. This is still reasonable amount of bone. Same thing on this side, but this is pretty bad. Okay, here check out this another one. Nice bone volume here. Nice bone volume here, less bone volume here. Here's another case right here. Tooth removed. This one had a reasonable amount of bone for an implant. So vary from case to case. Some people have tendency of losing more bone than the other one, and some people actually able to heal well and have good bone reservation. Again, thank you for watching. Have a good day. Bye bye everyone.